Hello and welcome to today's webinar, Direct Enrollment, Integrating with Federally Facilitated Marketplaces. Before we get started, I'd like to announce a few brief housekeeping details. Today's session is being recorded, and an online archive of today's event will be available a few days after the call. You will receive an email from AHIP that will ask if you would like to receive the archive, and please respond to that email if you would. I'd like to remind everyone of AHIP's antitrust statement and ask that you reference it in the Handouts tab. Please keep in mind that you may also ask a question at any time during today's presentation by typing your question in the chat pod on the left-hand side of your screen and then click Send. You can adjust the size of your slides to fit your screen by clicking the Scale button, which is located in the upper right-hand side of your screen. Today we're very fortunate to have with us Eugene Sayan, CEO and President of Softheon, and Robert Miller, who is Program Manager of Healthcare Reform at Softheon. So at this time, it's my pleasure to turn the floor over to you, Eugene.
Hi, thank you, Kelly. Good afternoon, everyone. And we would like to thank you once again for taking the time out of your busy schedules. There's no doubt that there's a lack of work for everyone these days, and we are truly grateful that you were able to carve out an hour or two from your busy schedules and attend today's webinar. Today we will talk about one of the kind of little known facts of the ACA, the days of everyone kind of rushing around getting the exchange operations up and running. That also includes the federal facilitated exchange marketplace, as well as the state-based marketplaces. So we will have a little bit of a deeper conversation around the aspects of direct enrollment. We believe that could be the blueprint of the future state of how healthcare, especially on the financial side, our products are being marketed and delivered to the consumers at large. So our conversation today is going to be discussing around the interfaces that we'll talk about the known components to it, and we will be able to take on the implementations aspect to it. So our agenda is, again, as I mentioned that to you, is starting October 2013, the open enrollment begins. In fact, the many state exchanges and marketplaces are already planning for what we call it a soft launch event for particularly the group of individuals, i.e. the brokers and navigators, having access, and let it be for purpose of training or giving them kind of an early visibility to the marketplace interfaces, if you will. As part of the interfaces, that, as you all know by now, that the feds have already declared that there is not going to be interfaces provided to brokers, especially on the FFM portal websites. And that led the conversation about the direct enrollment. In fact, the earlier references was being defined as a broker API references for carriers to be able to conduct and implement basically a web-based shopping sites for what also commonly referred as a QHP products. So today we'll discuss those in depth, and we hope that you will be able to gain some understanding of it, if not already. We hope that we'll continue to respond to your questions and some of your challenges. A little bit of a background about myself, and I'm joined today one of our program managers, Robert Miller. Myself and Softheon, again, clearly my background is a reflective of Softheon's background. We have been very active in what we call the next generation IT technologies. Softheon has been a technology company in the forefront of exchanges, and we have the great opportunity and privilege of working with organizations like Massachusetts Exchange, which is also referred as Commonwealth Health Connector, since 2008. So Softheon is currently located out of, we operate from the grounds of Stony Brook University. We are an organization rapidly growing. And in addition to our staff, we have 250 research fellows that will conduct various projects, various technology initiatives around, let it be cloud computing, let it be big data, or predictive modeling. Over the years, we have focused our attention, our value proposition, and domain expertise on healthcare payer practices. We also refer them as a Softheon's healthcare best practices. For those of you who know us through our daily Exchange Connected newsletter, this is a free service that is available to you. If you care to visit us online, you should be able to, if you are not already receiving, and subscribe to this daily newsletter. It talks just about exchanges. Our goal is to provide you the most up-to-date information at your inboxes before you even show up at work. So that will be we thought that would be a good way to start your business with all that exciting information coming out of, let it be states or feds or the other carriers as well. A little background again, we've been working over the past 10 plus years with one of the largest carriers in New York, especially with a membership count of 3.5 million memberships. The point of this argument or slide, if I may, is that this is a technology that's being basically developed over the last 10 plus years. This is one of those cases that preparation meets the opportunity. In fact, one of those opportunities was presented to us back in 2008. Was the initial implementation of the Massachusetts Health Connector. As you probably know them perhaps as a Romney Care or a Health Connector under different names. The Massachusetts Exchange is the nation's only fully operational, full-service health insurance basically exchange since 2008. Our current membership, in fact, has exceeded over 206,000. So the information here presented is somewhat outdated. Today, Massachusetts Exchange Health Connector provides all the way from fully subsidized coverage to a premium paying members for this entire state of Massachusetts. And there are a few metrics that I would like to share at this time in case you are kind of wondering the anticipation or the type of business operations you are looking to build around exchanges. Today we take roughly about 42,000 calls a month for 200,000 memberships. That ratio is comparison to the commercial healthcare payer market is quite high. And there's a good reason for it. If you take into account the type of demographics of the consumers are shopping for this kind of products, if you will, you are normally gravitating towards the population that is perhaps either old or age-wise, and they're in that pre-Medicare age group, if you will. You're also dealing with a population that is a possibly language barrier, income barriers. It's a unique population that is currently not being quote unquote catered within the commercial context altogether. Another important fact that the web utilization, despite everyone's expectations, we hope that we are wrong on that topic, but we do not believe that there's going to be a significant amount of web-based traffic. So many things that we're going to discuss today, in fact, direct enrollment, when we talk about a web-based enrollment, please take into context that those activities could be, in fact, performed on behalf of a consumer, let it be a broker or a navigator or even a contact center representative on the federal side or on the payer contact centers, and helping and coaching the members with the selection process, shopping process on the exchanges. Today, about nearly over 60% of the population in Massachusetts still heavily relies upon the contact center activities or basically the mailing the applications in the process. So the web utilization is increasing, but has not reached what we consider as still a critical mass. We believe the trend will continue, but we anticipate a significant outreach is needed in the early days of launching the exchanges, especially in the direct enrollment model, with a greater resource demand on the carrier's operations, especially the contact center operations. Very recently, one of our initiatives has been around creating an environment that we call basically exchange in a box. We are, once again, very honored and privileged. Over 35 regional health plans have chosen Softheon as the trusted exchange environment or mediator, if you will. We basically provide both the technology as well as full service, including premium billing as well as customer service operations to create a full service exchange unit, if you will, on behalf of our health plans. Today we are able to provide those services across 38 marketplaces. That includes 34 of them being the federal FFM states, in addition to the 4 state-based exchanges. Our customer acquisition, I am again pleased to report you that has continues to excel. We believe we are one of the largest install base of exchange integration platform companies out there, helping healthcare payers with these exciting yet challenging times. Proceed to the implementation of the exchanges. As you can see, one of the things that you're going to be referring throughout the presentation is the references to what we call the business process management. If you have been following from very early documentation came out of CSIO to any one of the most recent information, you will see Robert basically referencing these business process diagrams throughout the direct enrollment use cases or business scenarios. The challenging things about exchanges or marketplaces, as you know, there is no single entity will have all the necessary data at any given time. You may have a data, a point in time was the last time that kind of the information flowed through your systems. But the systems are it's a disparate systems. Here you're looking to basically the FFM end-to-end individual enrollment process that we can talk, given the opportunity, hours about just this one slide. But we don't want to take away anything from the topic of the conversation for today. But the point about this thing is that in order to successfully participate in marketplaces, you have to adapt to technologies such as service-oriented architecture, enterprise service bus, and business process management. These 3 critical components basically forms the foundation of marketplace operation, and it will give you the capabilities is needed or required to be able to interface and interact with various disparate systems, which, by the way, a significant number of those systems will reside behind or outside of your quote-unquote your firewall. It will be somewhere on the cloud, starting with, we're going to make references to the Federal Data Hub or Data Hub Services, depending upon the acronym that's being used, Hub or DHS, is the primary means of enrollment eligibility as well as the APTC CSR calculation, which is the very first few critical steps in the enrollment process. So taking those into account, the knowledge and adaptation of a business process management is critical too. Again, one of the main key value proposition or attributes of BPM is the ability to respond to the changes in a fairly rapid, agile way, if you will. We hear about scrums, we hear about sprints and whatnot. Ultimately, the entire BPM platform will be based on the ability to react to those changes as these guidance comes out and as we speak together. Okay, there is a question coming up already. If I could, we will defer these questions towards the end of the presentation, which we would like to give ample time. And during that time, and we will respond to the questions. But if you do have, before you forget it, please go ahead and post it under the Q&A session portion. We should be on the left-hand side of your control panels to the presentation, and we will make sure to respond to each and every one of those questions. Okay, so the DPM is a critical component to it because it really talks about the kind of the handshakes or protocols that these systems will adhere to. So, which is the underlying message there, the importance of the protocol. And again, we will talk about some of the requirements and the mandatory prerequisites that for a carrier to be fully participating in a direct enrollment workflow situations. We have in a slide we'll discuss about those critical technical components as well there too. So let's talk a little bit more about those direct enrollment cases. Before I turn over to Rob, I want to talk a little bit about the direct enrollment. Again, direct enrollment really came out of as a necessity, or I don't want to give it a names, but I have a couple of friends at the organizations like Gartner's and Forrester. We believe the trend right now is that the marketplace is, to a certain extent, I don't want to make a general statement, but there are a few of them, that they are kind of lowering the bar so that the 10-1 will be a successful date. So in that context, that the direct enrollment basically came out of after the decision of Feds not to provide a broker portal operation initially for the shop exchanges. And later on, the concept has been actually evolved to include the consumers at large. So in essence, post 10-1, consumers will have the ability to shop around the plan and products altogether. And then the direct enrollment provides that capability. So today we will review and present the specifications for the direct enrollment exposed by the Federally Facilitated Marketplace, or FFM for short, for both the web brokers and for consumers and issuers providing websites. And again, we'll collectively we'll refer to them as a FFM partner websites. And again, the purpose of the presentation is to communicate the overall approach and some implementation guidelines. Again, these guidelines are being revised, but I believe that the critical components are already in place. In the presentation, we will also identify and provide an overview of the various business cases and the integration points between the partner websites, that is the carrier's websites, and the FFM. Consumers are shopping for health insurance for themselves or their household members will have the choice of basically enrolling them into a QHPs, the qualifying health plans that are approved by the HIOS and slash the CMS. And then this can be done obviously through the FFM websites directly, or under the direct enrollment situation, could be done via the partner's website. And the APIs that are defined throughout the session, we'll talk about that, how that interface between the facilitated exchanges and the websites will take place. And as far as the lead generation, which means that basically consumer hasn't made up their mind yet. They'll come in and they may have to create an account, but they'll fill up their shopping carts, but they will not check out necessarily. They may come back at a future date to complete that transaction. And then once they become a member, then we will talk about how those individuals can in fact come in and declare things like changes. And those changes could fall into two categories, obviously. One could be affecting their APTC, which is the Advanced Premium Tax Credit, also commonly referred as a subsidy. But in fact, it's a tax credit. Let's not forget that. The IRS will be responsible of recouping that tax credit end of the year. Again, the guidance on that has not been finalized yet, how that will happen. But ultimately, this will be a responsibility of IRS to maintain the subsidy calculations are in fact in line with the declared or tested income. So the FFM integrations talks about two types of APIs. One will be the lead generation APIs. We'll talk about that. Basically, the partner websites will provide the educational content and the pre-selling of plans and before transferring consumers to the FFM site. So the consumer will complete all functions, including the eligibility, determination, plan shopping, and enrollment to the FFM. However, the partner website will be able to specify the issue or plan filters. The FFM will apply as part of the consumer's plan shopping. This model is offered as an alternative to the Direct Enrollment API to support issuers that they may not be ready to implement the full Direct Enrollment API. Under the Direct Enrollment API model is that the partner websites will use the user interfaces and the services provided by FFM and providing the consumer a seamless transition between ultimately two different websites throughout the process. Let's talk about basically the high-level guidance. We'll talk about that. The issuers must declare an intent to participate in Direct Enrollment. Obviously, this date has passed by, but to my best of knowledge that the carriers are still able to participate or request to participate on the Direct Enrollment model. So if I may go back to again determining the Direct Enrollment model, what can be to understand and better understand the capabilities is that under the Direct Enrollment model that the consumers are seeking to enroll in a coverage through the exchange. As you know, they need to submit an application to the FFM for determining eligibility for QHPs. And if interested in for advance payment of premium tax credits as well as cost sharing reductions. If they determine to be eligible, then the consumer can enroll into QHP through the FFM. The eligibility determination process includes the collection and verification of demographic and income information and verification of information from federal data sources such as Social Security Administration and the Internal Revenue Service, the IRS. As part of the Direct Enrollment, as part of this process, then the individual seeking financial assistance, the FFM will also determine and assess the household members' eligibility for Medicaid or CHIP. So there is a little bit about an overarching effect to Magi-based income calculations and how that can be reflected into the exchange enrollment process. So all these capabilities will be provided within the context of the Direct Enrollment processes, initial enrollment eligibility component. Again, I will make sure that, I know Rob will do that a far better job than I do as he talks about the various business use cases. So upon completion of the plan shopping, then the consumers then will be basically a Direct Enrollment model. The partner website will then submit the enrollment request to FFM through a web service invocation. Again, we will talk a lot extensively about those web service invocation, how it can be done. As you can see, that part of that interface will be that this interface, the communication, will take place on the cloud, as we call it, using a public network interfaces. So there's no private interface, as you probably well know by now. However, the information will be always compliant to HIPAA. So the things like encryption at rest and encryption in transit. So to support that operation, then the brokers will have to issue basically a certificate or SAMLs. We'll talk about more about that for the authentication of the partner IDs. So this method of data exchange, by the way, has been successfully implemented across many, many industries. Let it be obviously the financial services and banking is being another one, has been doing this kind of activities for many, many years. So it's a proven technology, but it is a new concept for the health insurers, healthcare payers. Once the initial part of the onboarding process, by the way, that Softheon is one of those companies, have successfully completed the connectivity testing and other aspects of the Direct Enrollment verification. It's a multi-phase process, as you will imagine. The feds have identified about nearly 42 business cases, and these cases that are obviously being provided to you under multiple situations, and will be available too as part of the pre-enrollment process. And during that pre-enrollment process, obviously, then you'll be performing various tasks and responsibilities. Our latest number is about the feds has received only 81 applications, a little over 80 applications. So considering the number of carriers, which makes me believe that only a very small percentage, we believe even less than 10% of the carriers, are going to be taking advantage of this approach, which, again, as I said, our predictions, if it holds true, it could be the future model of all exchange operations, where the responsibility of building and operating a consumer-facing, basically the shopping or web portal or support site, will lie within the hands of carriers or their trusted partners like Softheon or other web-based entities like eHealth or Get Insured. And part of the process that, again, we expect that few more rules and regulations that are being discussed. So as part of this interface, let's talk about what are the components to it. Again, by the way, that the debt production environments will not be available once the FFM goes into basically a production migration cycle in starting early September. So your window of opportunity to make sure that things are working, I hate to say that it's a little narrow, but can be done nevertheless. Some organizations that we know quite well, that they have been already in the forefront of utilizing the web services and two-way certificates and SAMLs and via capabilities, obviously. But there are companies out there can help you out with those kind of efforts as well. Let's talk about some of the assumptions under the direct enrollment model. Once again, I think we've repeated multiple times that the partners will send the enrollment request through the websites as the consumers do the initial outlet from the lead generation, meaning that creating their just IDs and having made up their mind exactly what product to purchase, but they're filling their shopping cart. Then the enrollment transactions between the partners and the FFM will be done through the hub or DHS or basically the data service hubs in real time or near real time. We believe most of the activities will happen in real time, but when it gets to the point about things like payment conciliation, initial binding payment, I should say, and the consumer can opt to choose bill me later, or that means that they are basically requesting a paper-based invoicing process. So if that was the case, then obviously then the process will be more taken offline mode, if you will, but nevertheless it will be a significant portion of the direct enrollment would rely upon a real-time communication between the carrier's partners website and the FFM as well as the Federal Data Hub. Once again, the information once being verified, eligibility verifications and APTC calculations, then the information that will be rerouted back to the carrier website. The hub response times, there will be some SLAs. We don't know what those SLAs are or how do you basically enforce those SLAs, and there are a few questions still yet to be obviously answered. And all this process obviously will be all configured under this, what we call a trusted relationship between the partners under this unique ID, partner IDs, as well as the federal systems that are being designed to take in place. So let's go back very quickly, by the way, we're going to refer to these terms, what we call the actors in the process. Obviously, there will be an issuer, that is an entity licensed by a state as an insurance producer that offers a QHP in accordance with certification from an exchange. The web brokers are the web-based entity licensed by a state as a broker providing a website that consumers can use to shop for plans for multiple issuers. Again, this could be a third-party entity that the carriers might be interfacing or building that process in their internal resources. We will talk about, again, the agents and brokers just from a semantic perspective. An agent or broker is a licensed individual by the state that may be an independent and a members of a brokerage or an employee of an insurer or a web broker. The partners, again, collectively referred as the web brokers and issuers. Again, this direct enrollment applies to as a broad level to both user groups. The applicant is an individual who wishes to apply or has applied for eligibility to enroll in a QHP. And the consumer will be is a person who has engaged a web broker or issuer seeking to enroll himself, herself, or other applicants that they are associated with an QHP. In relationship to the applicant, so the consumer must be someone who is an adult who is in the application's household. As defined by the federal mandates, I can refer back to the particular reference ID there too, or as a family defined. If the application is a minor or incapacitated, someone acting responsibly for an applicant is deemed to be a consumer. So let's talk about at the very high level, the kind of a little bit of process diagrams. And by the way, you should be able to receive some of the context. The problem is, I'm sure that you have, just like many of us today, suffering from information overload. If that is the case, that we will be more than happy to basically provide additional guidance and support. This is a very high level, basically a process flow. And Rob was going to walk us through its distinct use cases, how that process will happen. I think we reported multiple times. The blocks that are highlighted in orange, ultimately the activities that the carriers, you will be responsible of executing or performing. And the blocks that are indicated as the green is the federal exchange or federally facilitated marketplace website. And then blocks that are indicated in orange, basically kind of a handshake or change of information through different techniques, all the way from URL redirect to the websites and what it means that between the federal systems as well as your websites altogether. Again, I'm not going to go into the great detail about. I think Rob's going to talk extensively about each and every one of these blocks all together as we proceed. So, but at a high level, I think we'll talk the consumer creates an account partner website, and then it will be redirected to a FFM website. Assuming that they're eligible, then the consumer will then transfer back to by the respective FFM, if you will. Consumers redirected to, if they are, by the way, by accident, if the consumer happens to log onto this to the process, and part of their credential actually falls outside of the state or the carrier. Obviously, this is a kind of a simple rating demographic capture information. If they deem to be from a state that has a state-based exchange, then the consumers will be redirected to a state portal site. They will not come back to the partner website. So there might be some additional guidance, and I should not forget that we have a famous line: we reserve to be wrong. Throughout this presentation, I will kindly also ask you to question every word that we are saying. Not that we try to misinform you, but the information becomes obsolete in some cases in number of days. So we do apologize for that inconsistency. But intent here is to be able to make sure that the consumers are looking for products coming from the state-based marketplaces will not be qualified and processed through this activity. Assuming that, again, they are, however, from an FFM state, for argument's sake, they will be then the interaction will continue to take place between the partner website and the FFM, as well as the data services hubs, or hubs for short. So as I am going to get very close to it, it's a very high-level diagram, as you can see from this particular. This kind of, again, diagrams, it just high-level reflects the activities. It will also refer to as an API consumer interaction model. As you can see here, that the FFM APIs for partner websites will support two types of interactions. One will be the secure transfer of consumer to the FFM and back and forth. The consumer will be transferred to FFM websites to complete the eligibility workflow and then return to the partner website. The web services, the partner websites, will invoke one or more web services rather than a URL redirection, what we call it. Then the entire experience will be then executed throughout the partner website, but the communication is critical to the various FFM components as well as the Federal Data Hub. So the figure shows that the consumer interaction model has illustrated with FFM and the partner websites, also the interactions of the partner website with the FFM through the Data Service Hub. The secure transfer interactions will occur directly between FFM and the partner website. URL will be sent by the partner website as part of a transfer request to the FFM, and will be used based by the FFM to navigate the consumer back to the partner website. The partner website will be able to retrieve the eligibility information also by invoking the appropriate FFM web services. And the web service interactions between the FFM and the partner websites will be routed through the hub. The FFM will manage the business process aspect of the web services and the exposed coarse-grained business services, also commonly referred to what we call it a transactional web services that can be consumed by partner websites. Again, we're talking about, I suspect that the audience is quite familiar with the web services concept altogether. The protocol that's going to be used based on called SOAP. It's a Simple Object Access Protocol, also commonly used in, again, as I said, in many industries, including financial services and banking. The hub will manage the trading partner agreements, including onboarding of these partners. So all FFM web services will employ a standard web service header that includes identifying information for the transaction with a custom payload for each type of transaction supported. The hub will then pass through the requests and responses by invoking the corresponding FFM services. And the hub is expected to perform minimal inspections and actions and focusing on the authentications, auditing, and monitoring functions of the interactions. So hub's role is if any, little. It's a simple, basically a service bus or a gateway, if you think about it. On the other end of that hub is basically systems that are being provided by SSAs and IRS and whatnot, who will do the actual data validations and verifications. The hub's role is no different than what we call basically the FedEx of information gateway. The information is being delivered back and forth all through the hubs. So that kind of covers I guess the interaction component to it. So with that in mind, I'm going to turn over to Rob, and he's going to walk us through some of these distinct use cases. We believe the importance of direct enrollment in the future state of exchanges marketplaces from carrier's point. And I guess the basic premise before I turn over to Rob is our goal, our predictions, working with some of the innovators in the space, is that the no wrong door concept. We want to be able to create the feeling from the partners, the carrier's website, for consumers to come in, and we don't want to lose those consumers for all intents and purposes. In addition to making sure that the time and effort and all the resources that they have spent over the years about basically protecting the brand that you build, it has a greater value in the consumer's eyes. So the websites, web portals that are going to be available to the consumer will serve every one of these purposes. So with that in mind, I'll turn over to Rob. Rob?
Thank you. Okay, so thanks everybody again for joining. We're truly excited to be presenting to you on this particular topic. So without further ado, let's kind of jump right into the different scenarios. So essentially what we did here is we broke up some of the different models or different entities into multiple scenarios. So in this case we have about 6 scenarios that we wanted to walk you through. So starting with scenario 1, which is the consumer lead generation option. So this scenario basically applies to the consumer shopping for insurance from the partner website, whether it's the issuer or what they call the web broker website. As part of this experience, if the consumer decides to shop for a QHP for their health coverage, the partner website will transfer the consumer, as you can see on the diagram here, to the federal marketplace for determination of eligibility for a QHP, whether or not they have financial assistance, APTC, CSR subsidies. In this model, the lead generation model, if the partner website's looking to use the lead generation option rather than direct enrollment, once the eligibility determination is made by the federal marketplace, the consumer will not be transferred back to the partner website to complete their plan shopping. Rather, the federal marketplace will guide the consumer through the shopping and enrollment process, including the attestations, as well as towards the end generating the final 834 transaction to notify the issuer. If the partner website supplied a filter for the issuer plans to display, the marketplace will default the plan's results to be filtered accordingly. So although the user may not be shopping on the actual website, the consumer will only be seeing the plans for that particular issuer. However, there will be an option for the consumer to remove that filter during the shopping experience on the federal marketplace. If the partner website has supplied a return URL as part of the lead generation, the federal marketplace will transfer the consumer back to the partner website after the enrollment submission. So just to sort of walk you through just very quickly on the top left, as you can see, the consumer is going onto the issuer or web broker website. Once they register, that information is passed, as you can see, through the secure redirect through to the federal marketplace, in which they are basically registered with the marketplace as well. That follows the eligibility determination workflow. Once that's completed, then the user again will shop, compare plans, they'll select a plan, the attestation, they'll submit their request, and then as you can see it kind of splits out so that it goes to the issuer's payment portal. An 834 will be submitted to the issuer on that nightly batch schedule. And then, of course, if the issuer has any additional shopping or any other products that the member may wish to select from, they can certainly do that as well. So in the second scenario, this is basically a returning consumer. So this is basically an extension of the first scenario. So if the user applies in scenario 1, as we talked about during the lead generation scenario, the consumer will stop prior to enrollment. They may actually return later to continue shopping. This also applies to other previously registered federal consumers, either directly on the FFM or through another partner website, accessing the partner website. The consumer may continue their eligibility application from the last step during their previous interaction with the federal website. The partner website will reuse the previously generated consumer ID as long as they were registered, or generate a new consumer ID. The consumer ID along with the federal assigned consumer ID will be used in all interactions with the federal marketplace. So again, just to follow, as you can see here, there's a login process at the top left, as long as, again, they were provided that original ID. The data, again, will be passed directly through to the federal marketplace. The orange line, as you can see at the top there, indicates that the user may not see this interaction. Their next step in their process will be the retrieval of the household eligibility details that comes directly from the federal marketplace. And then again, the consumer can potentially compare the plans, select the plans, perform their enrollment attestations, make their payment, and then submit the enrollment data, which again will be passed, as you can see, through the XML definition here, through back to the federal facilitated marketplace. And then lastly, as in all scenarios, the 834 will be sent back to the issuer confirming that enrollment. Next scenario. Okay, so this scenario is the new federal facilitated marketplace consumer initiated workflow. Essentially, this is a consumer shopping for a health insurance on the partner website again. As part of the shopping experience, if the consumer decides to shop for a QHP for their health coverage, the partner website will transfer the consumer for the FFM website for determination of eligibility for QHP. Once that eligibility determination is complete, the consumer is actually transferred back. This is that quote-unquote direct enrollment, not just the lead generation, back to the partner website to complete their plan shopping, ultimately resulting in enrollment under a particular QHP for that issuer. The partner website will use its own tools to guide the consumer through, all built internally by the issuer themselves, through the QHP shopping and enrollment process. The issuer website will then present the consumer with various views of QHPs, matching their needs, filtering options, again, if they are built in, including the information on benefits covered and premium costs. The QHP information will reflect the CSR and APTC subsidies, the advanced premium tax credit, that the consumer is eligible for. This, again, will occur as the data is originally passed back through CMS. Once CMS confirms eligibility, they'll pass back any available subsidy information to the issuer portal so that it can be presented to the user. When the consumer is ready to enroll into a QHP, the partner website, again, will capture the enrollment attestations, including the APTC information, and submit an enrollment transaction back to the federal marketplace by invoking a web service through the Direct Enrollment API. The issuer's website then may collect payment, as with all the other scenarios, for the initial premium, either prior to the submission of the enrollment transaction or after a successful submission. The federal marketplace will then process, again, the enrollment transaction and generate an 834 transaction that will be sent on a nightly basis. Next slide. On scenario 4, this is slightly different, so you can see the entity is slightly changed. So in this case, this is a new enrollment that is actually initiated by the broker. So this scenario really applies to a consumer shopping through an agent or a broker. Prior to being able to assist, as you can see on the top line of the workflow diagram, agents and or brokers will have to have completed basically the registration process with the federal marketplace. This happens again on the marketplace, the federal marketplace website. And this is depicted above, as you can see, in the CMS Enterprise Portal agent broker registration section, which is documented in some of the documents that have been provided through to CMS. Outside of the FFM, agents and brokers would also need to establish access to partner website tools as agents and brokers. This is the typical registration process that agents need to go through with the issuers. In the documents that have been provided, there's more details again on the prerequisites for assisting federal facilitated marketplace consumers. As part of the agent broker assisted shopping experience, if the consumer decides to shop for a QHP for their health coverage, the partner website will transfer the agent broker to the federal facilitated marketplace for determination of eligibility for QHP for the consumer. After completion of the eligibility determination by the federal marketplace, the agent or the broker will be transferred back to the partner website to complete the consumer's plan shopping, ultimately resulting in an enrollment under a QHP. Very similar to the previous scenario, but in this case, again, it's the broker that is facilitating this process. The issuer's website will then, again, as in the previous scenario, will use its own tools to guide the agent and broker through the QHP shopping and enrollment process. Using this website, the issuer website or the web broker website, if you will, they will present the consumer with various views of the QHPs, matching their needs, including, again, the information on benefits covered, premium costs, which will reflect as well the subsidy information that may be provided for the consumer that they're eligible for. Once a consumer is ready to enroll into a QHP, the agent will use the partner website to capture enrollment attestations, including, again, those for the subsidy information, and submit an enrollment transaction to the federal marketplace, again, through the same web service provided in the Direct Enrollment API. The agent may use the partner website to collect payment for the initial premium, either, again, prior to the submission or after submission of the enrollment, according to the issuer's policies and procedures. And then lastly, again, as in all the cases, we will receive an 834 transaction to notify the user. Next slide. Scenario 5, so this is essentially any changes to an existing enrollment after the member has already been enrolled that may impact their eligibility. So in this, essentially a consumer that has already enrolled into a QHP, whether they have subsidy, APTC, CSR or not, may be reporting changes in household membership, income, or other demographic information. These changes may impact their eligibility for QHP or the subsidy information, the current subsidy values that they've received during their initial enrollment. These changes in eligibility may allow the consumer to add a new member, change enrollments for one or more members to a new QHP that is potentially more favorable to their current eligibility. So as you can see here again, the workflow is very similar. As the individual logs into the issuer or broker website, to initiate a change after enrollment. Again, the information will be passed through the secure redirect process to the federal facilitated marketplace. Eligibility determined flow for changes will occur, and then based on the information that's changed, the user then will be presented with the additional data to compare plans, make changes for maybe one of their dependents, make those changes to the plans, attest to the enrollment changes, and then again finally submit the enrollment data back through, as you can see on the back end, through XML back to the federal facilitated marketplace, which again will result in an 834 being generated. And then Eugene, scenario 6, if you don't mind, the previous slide. So scenario 6 is changes that don't impact eligibility. So these are changes that won't affect the current QHP or the various rates associated with it. And it's a very similar process, but as you can see, in this particular scenario, a consumer that is already enrolled into a QHP returns to report some changes, potentially to income or demographic information. But in this particular scenario, this does not change their current eligibility for subsidies, and the information is updated and processed by the federal facilitated marketplace and conveyed back to the issuer. So in a very similar flow as you saw above, the main difference here is during the eligibility determination flow, it'll be determined that there's no change in the subsidy information that is going to be provided to the consumer. And as in the similar scenario, once that is done, the changes will be submitted back through the XML interface and then processed by the federal facilitated marketplace and sent through the standard 834 batch process during that nightly run. And I think, Eugene, if we can pass it back to you for the next slide.
Thank you, Ralph. So let's talk about a little bit about the protocols and the technical implementation guidelines, if you will. Before any partner websites can interact with the FFM, then the partner website need to complete the onboarding requirements with the hub, as I mentioned earlier. There is a requester onboarding summary document should be available on the zone. We have some few references for you to follow, and I trust you already have been visiting, a quite frequent visitor of any content being provided either through RegTab or other sources. Once the connectivity is a prerequisite is being accomplished, and then the partner websites also need to comply with the security requirements governing access to the federal system. This will include the signing a data use agreement with CMS to become an official partner. The secure transfers of consumers between the FFM and the partner sites basically will be done for the eligibility determination purposes to begin with. And then once the user completes their function on the FFM website, then they will be securely transferred back to the partner website. So to achieve this secure transfer, that the security consideration and correspondence provisions are proposed to be put in place, and for both on the inbound and outbound transfers of the website. So once again, there are an ongoing documentation around what those provisions are, all the way from protecting the data transfer, ensuring the user is being authentic. One of the components of the Federal Data Hub, the enrollment eligibility component, that the use of FCRA, Federal Credit Rating Agencies like Experian and Equifax for the both identity management and authentication, as well as income verification. So those services are going to be a critical part about this system altogether. In addition to that, the information needs to be secured from HTTP directs from FFM to the partner sites. And once again, the protecting any data being transferred from FFM site to the partner site, especially the FFM assigned consumers to be used for subsequent web service requests, has to be safeguarded as well. Partner site needs to validate an HTTP redirect. Once again, has to be a trusted website, two-way authentications with extensive use of SAML2 protocols. And the FFM needs to securely deliver the parameters back to the partner site, and so that the consumer, or through the appropriate programming, that the consumer's experience becomes they don't have to start all the way from the beginning and re-enter the data and re-identify. So there is a certain element of data consistency or process consistency, I should say. So the critical components, as I mentioned earlier here, was that falls under that the hub certifications and a two-way secure socket interface, as well as the securing the appropriate security certificates, also commonly referred as X509, and then each one of the web services requests being made on the internet, public network, will have to then adhere to the SSL certificates and whatnot, and then the information, every information will be then headed in we call the security header of the web service calls that are going to be made between the direct partners as well as the FFM. There are some, just to wrap it up, there are some resources available for you to, if not already, you should be there, but all the way from some references, there are even sample applications, as I said to you, if you are considering using the direct enrollment approach to enable your existing shopping portal, let it be the carrier-based single payer sites, or it could be other type of a web broker activities or not. The information is available to you. If you care to do so, you can also reach out to us. Our contact information is available, will be available within the next slide or two, and we will be more than happy to share and collaborate with you in your efforts altogether. Once again, we thank you very much for taking the time out of your busy schedules. At this point in time, we will be ready to take your questions, and I will turn over to Kitty for that.
Okay, thank you so much. We do have quite a few questions that have come in today. Our first question asks if you could please provide a definition of an exchange in regards to this discussion.
So the exchange, I guess, that we are referring to is really what's being mandated within the CA Accountable Care Act. Also, the term is being later on replaced by the term marketplace, and we hear multiple reasons why that was the case. In any event, it's basically a place that consumers can simply log in and purchase the health insurance that they feel what's right for them, and in the process, being able to take advantage of some of the incentives that has been offered by the federal about the advanced, again, premium tax credit. Once again, I would like to underline the word, the advanced tax credit. So in essence, that individuals receiving the tax credit from at the end of the year. We believe the IRS is very busy these days and building those calculations into your tax forms. and there will be a year-end reconciliation process against the money you have kind of advance withdraw from that credit, and how it will be applied towards your true end of the year tax refunds and whatnot. So the consumers can take advantage of those features, obviously. And once again, there are some, we see that new technology has been evolved. There are a lot of Travelocity, Expedia-like websites that are being built that has been around for some time, over the last several years especially. And so that ease of being able to compare plans and being able to choose the right plan for you. Obviously, the key thing here is basically in order to ACA to work, I think that we all know by now very well that the individual mandate component is a way to spread the risk across not just on the sick and needy people who has an insurance or will need an insurance or get an insurance, and they haven't been in the past. But we also want the healthy population to come into the system so that the system will have a kind of a healthy balance, if you will, and a healthy base to be able to provide those services to those in need. So in that context, the exchange or marketplace is where a place can come in and buy shop products and basically choose the right plan, come back and being able to make changes to it. They have a newborn. They would like to be added independent to it. These are the critical components of the FFM. Now again, we believe that beyond year 2, year 3, what we see here as an FFM marketplace could very well transition into basically a gateway or exchange site or portal site for Medicare, because the FFM is not an indefinite solution. It is basically a stopgap measure for those states have declined to operate their own state-based exchanges. Once again, in that context, we believe the state-based exchanges will morph itself into integrated eligibility for both Medicaid-based plans. Perhaps Arkansas model will succeed with the privatization of the Medicaid, which will then become a state-based marketplace for those individuals. And I think that with all due respect, direct enrollment model could be the future of the marketplaces from from the carrier perspective, to be able to provide a no wrong door concept altogether, so that the individuals can come into one place and one place only to their favorite. Just as today, I can go to US Air websites or Delta website. I can purchase a ticket there, or I can go to one of their trading partners. I can purchase the interface, the data, the product that I'm buying is pretty much the same. The experience might be a little convenient. We expect that the mobile will be another major leapfrog. I'm pleased to report you that Softheon is already piloting several mobile-based technologies. We believe the use of web is going to be very limited. In fact, at the risk of some of the questions, I'm going to answer some of the questions in advance that was pointed out about that. What about the cases that the paper processing will take place? At this point, we don't have a clear guidance. We hear that the feds will hire basically 9,000 call center representative CSRs during the open enrollment seasons, and we expect the function of that contact center will be also handling that famous 27-page enrollment application, brought it down to 3-page. But let's not be cognizant, forget the fact that that 3-page was more like a summary page, which is the kind of initial onboarding or lead generation. The true plan product solution will still require a complicated, basically a paper form application, which will require a significant resources from a contact center person to be able to communicate either through directly with consumer or one of their trusted navigators or brokers to complete that enrollment onboarding application. So long answer to short question, but I hope I covered a broad base, if you will.
Okay, thanks for that. I hope I'm following along okay with all of the questions. It sounds like you answered quite a bit there.
So, Kitty, I can actually go through the questions if that's okay with you. I see a lot of questions. Please, by the way, continue to post them up there. Again, we are excited that actually we still have quite a few people stayed online with us. Again, the next question was about that the lead generation model is not going to be implemented upfront altogether. That is also correct. Once again, the latest guidance that we have received is that not every aspect of direct enrollment will also be implemented. But we expect that those components will be kind of as a production line, if you will be rolled out as the FFM goes through kind of a version 1 and 2 and 3s and whatnot. We expect those capabilities to be broadly available, especially at the API level, for individuals to be able to interact with FFM through basically the windows of carriers-based portal websites altogether. So that's an excellent question, and that's definitely we should be considering and following. Again, in the new guidance that AHIP does a wonderful session. I trust that you have been already participating, and Candy's and Jeanette's updates. I continue to encourage you to reach out to them. They are your voice, and they are our guidance and advisor to us. I'm proud to say that we do quite a bit of a collaboration with them as well. And they will get us the most recent, most up-to-date, and most accurate information at any given time. Let's skip to the next question that I'm hearing is that again, the question about the consumers submitting the hard copy application to the FFM, including a broker ID. Once again, the paper is kind of the big elephant in the room that people are somehow not paying attention. Having done a significant paper-based automation for some of the largest carriers, to this date, the paper processing still in effect is probably one of the most time-consuming and resource drain to the carrier. Let it be initial enrollment application in the individual or small group market, experience in community-rated products altogether, as well as even paper-based claims processing still do exist today in the payer world. The numbers are declining, but still there. So we think that if you take into account that the type of demographic are qualified for subsidized health plan coverage QHPs through FFM, I think that the high percentage immigrant population, migrant workers, people with language barriers, these folks will have the easy route for them will be to filling out a paperwork with the help of one of their cousins and relatives, or a welfare worker, or a social worker, and quote unquote the navigator and brokers. And this will be the preferred method of communication for them. I can tell you that in fact there are provisions. We haven't talked too much about it, about the payment aspect to it, but speaking from the experience that Mass Connector for the last 5 years, we have walk-ins. We have folks come in with a jar of pennies. Up until very recently, that basically a provision was mandated to at least be able to write a check. But we had people walk in with dollar bills in their hands and would like to make a payment. And these people need a process of being included in the system. And ACA is very specific about that the carriers must be able to provide, the exchanges must be able to provide, in fact, walk-in centers. So once again, it's one of those things that, small, tiny percentage of your work, but it will take significant amount of resources to get it up and running. A question about that was can you please provide additional info on the agent broker registration process? Once again, I'll revert back to the previous slide. I will kindly ask you to, again, follow these information available on the zone. I trust that you have some information. Once again, if you are not able to, please contact us, and we will either redirect you or we'll be able to provide some content and some information for you in response to your questions. I'll go to the list. The next question is, does the FFM replace the state in eligibility determination? That is correct. In fact, the state does not do an eligibility determination. Even the states will be required to use the Federal Data Hub for the initial enrollment eligibility determination as well as the income verification. So that responsibility has always been with the Federal Data Hub. And the Federal Data Hub, as it does the income verification in addition to eligibility, it actually adheres the MAGI rules, also commonly referred as a modified adjusted gross income rules. And that includes obviously the individual's eligibility for Medicare's or even Medicaid and Medicare. So the question about the dual eligibility, obviously this is another topic for perhaps another webinar. But these questions is being kind of answered. But the underlying message is the Federal Data Hub is always the entity responsible of both eligibility, enrollment, identity management, authentication, as well as the income verification. We had a question about the SHOP and group enrollment processes. So as you know, the process that we have so far will cover is a consumer, and consumer in the sense that we are referring them as the individual shopping for themselves or for their family coverage. The SHOP is under the current rules that it's pretty much similar to it, meaning that I'll fast forward the initial group establishment record. But beyond that, the enrollment transactions will follow the exact same process. The Business Express model that we have implemented up in Massachusetts, or as well as the SHOP exchange model, the employer choice model, the employees of businesses of up to 49 employees will be able to basically employer have the responsibility of choosing a plan and metal tier. And the employees will be able to then able to come in and finish up the remaining of the demographic information. And the part of the rating engine interface will only take into account the employee's age, zip code, and tobacco use. And those elements will be obviously populated as part of the SHOP enrollment process as well too. As you all know very well, that there is no group onboarding X12 EDI transaction. So what we are seeing that basically disparate approaches. Certain states are requesting XML web services-based interface to be provided between the carrier and the exchanges and the marketplaces. Carrier returning the group ID, and then therefore per companion guides, respective companion guides, the 834 will then have the group ID as the parent ID, if you will, entity. That so that can be a group level billing or enrollment process can take place. The feds haven't, at least I will have to maybe take this one question away. I haven't heard a final guidance about the preferred method. And if you do know it, please do type into the Q&A section that I can basically let the rest of the audience know about it, and I will make sure to give you the credit for it. But as soon as it becomes available, we'll know that. But again, as I said, certain carriers and certain state-based marketplaces are talking about XML real-time web service real-time interfaces. Other ones referring about some kind of a XML, other type of data feeds that has to be changed on an offline batch basis prior to, again, passing the 834 data for the employee records. Question again, a type into the saying about is there going to be group enrollment perspective? We'll be happy to do that. So we'll be happy to put together another implementation altogether. Question was raised about the broker file attestation for a consumer. File attestation, what process that you're legally allowed to use. Once again, I think the broker onboarding process at the federal level will be left in the hands of the carrier that is coming through it. As you know, the broker compensation, especially the commission processing, is on the federal marketplace, will be directly organized and correlated by the carriers themselves, so that that process still continues to remain in effect. And then we believe that we'll have to go back and look at one of the WSDL definition about the consumer onboarding process and how that data can be passed on to it. But we suspect that just like 834 will have a place in the interface for the information to be passed on to the federal exchanges, so that the 834 data feed that's going to be generated as a result of the direct enrollment will have that broker ID, such that the broker can be then compensated or commissions can be adjusted based on that income information altogether. We're coming to the end of it. Can you provide a copy of the webinar? This webinar, if I'm not mistaken, is recorded and should be available very shortly by AHIP. So if you are an AHIP plan, if you're an AHIP member, again, we are a very proud and privileged member of AHIP. We have the utmost regard. If you are not, I highly encourage you to become an AHIP member. They have fantastic, great resources, great people, great events. So we hope to see you in one of those events altogether. With that in mind, I think that we are kind of a little ahead of our time, but we still have 10 minutes to do. We'll wait a few more seconds. If you have additional questions, we'll take those.
Okay, it looks to me like we've been able to address all the questions that the audience has today. And with that, we'd like to thank our audience for participating in today's conference. And we'd like to thank our speakers for that wonderful presentation and for sharing all your thoughts today. At this time, this concludes the webinar. We thank you again and hope that you'll enjoy the rest of your day.